Hey Med Fam! Today we are diving into one of the most important steps of cardiovascular examination, which is auscultation of precordium, where the teeth tell the story of your heart. But before we begin, there are certain prerequisites which needs to be fulfilled, such as the proper positioning of patient, adequate exposure, use of diaphragm for high-pitched sounds, and use of bell for low-pitched sounds shown here. Now, let's head towards it.
Assalamu alaikum. My name is Dr. Muhammad Hamza. Today I will perform the auscultation of the precordium. Now, this is the diaphragm and this is the bell.
So as we can see, after localizing the apex beat in the fifth intercostal space in the left midclavicular line, Dr. Hamza will be auscultating the precordium with the three fingers on the carotids. First, the mitral area which overlies the apex beat, tricuspid area in the left fourth intercostal space, pulmonary area in the left second intercostal space, and finally aortic area in the right second intercostal space. Now he will be auscultating with the bell of teeth, again with the three fingers in the carotids in the mitral area, with the patient lying in the left lateral decubitus position and the breath held on expiration to look for any added sounds such as that of the mitral stenosis, which is a low pitch mid-diastolic murmur best heard in this position. Now he will be auscultating the patient with the sitting and the leaning forward posture with the three fingers and carotids to look for any added sounds as that of the aortic regurgitation, which is best heard in this position. Now Dr. Hamza will be looking forward for any radiation of the murmur in the neck or any carotid bruit if present so as shown here. So you can clearly see, after the proper positioning of patient and adequate exposure, we'll identify the auscultatory areas such as mitral, aortic, tricuspid and pulmonary areas, with the diaphragm first for high-pitched sounds and with bell then for low-pitched sounds shown here. That wraps up our video on auscultation of precordium. Keep practicing and stay confident until next time. Thank you so much.